We are very fortunate to have this SimMen 3G here in our sim lab. We have 6 of them, and they really allows us to recreate different clinical scenarios which we want to play for our students so they can practice. This SimMen really can do a lot of things. We can have him cry, we can have him bleed, it can have a seizure, it can have pneumothorax, which they have to do some emergency procedure to save his life. Of course, it can go into cardiac arrest, so they have to do a CPR and intubate him. All those things are really very helpful when it comes to creating different scenarios and keeping them very realistic. There is a lot of good things about simulation. And one of the things that really helps and gives our students opportunity to check their decision-making skills and clinical judgment skills in a clinical setting. Another thing is that it's a teamwork. It's all about effective communication between all the members of the team. So this is what happens currently in medicine, that medicine is moving towards this model of care where there is a group of specialists, a group of people who take care of the patient. It's not only a doctor, it's also a nurse, it's occupational therapist, dietitian, counselor. So the effective communication is the key, and that's what we emphasize also during those training, and that's what we do and give feedback on during the debriefing process after the training. And another thing about simulation, it's all about patient safety. So this is a safe environment. Our students can make mistakes. This is the place to make those mistakes, and so they can learn from their mistakes. They will avoid them in the future. So that really boosts their confidence. They can build on that experience, and that better prepares them for the real clinical experience later. This simulator can even blink and can constrict pupils and dilate pupils, so we can produce some neurological problems for this simulator, which is very unique and gives us better chance to make it as realistic as possible. Our students can do a physical exam, they can interview the simulator, and we can use our standardized patients to answer all the questions they may have. They will take history, and they can perform some procedures on the simulator. So they can insert a catheter, they can intubate, they can give some medications. When we use the simulator, it gives us opportunity not only to check if they can make a correct diagnosis, but also to see if our students know what kind of treatment to implement. Because they're gonna see the reaction on the monitor, how the blood pressure changes, how the heart rate changes, how the saturation changes. So all of those parameters which are normally monitored in an intensive care unit or in a hospital, they will have it here, and they can see if they are treating the patient properly.